Hi, everyone. I'm Chris Fleming.
And I'm Jessica Bylander.
And welcome to another edition of Health Affairs This Week. Well, Jess, last week, our colleagues Rob Lott and Leslie Erdelak recorded their session about 24 hours after the siege on the U.S. Capitol. And we are now recording on Thursday, January 14th. We're recording about the same period of time after the first ever second impeachment of a U.S. president. The House of Representatives, as you know, as I'm sure our listeners know, impeached Donald Trump for his role, or as they saw it, in inciting the insurrection at the Capitol. So, we're in challenging times. I mean, how you doing?
I'm doing okay. It's definitely unprecedented times in my lifetime, and yeah, so I guess I'm in the sort of what's going to happen next. Biden is being inaugurated next week, so I think, like everyone, I'm a little on edge in terms of what the next week might look like, and my understanding is, the Senate hearing the Senate trial is not going to happen before that inauguration, so it may be an after the fact thing. So yeah, I mean, it's challenging times. I know some hotels in the DC area are not allowing reservations for next week, out of kind of concern for what might go down. So definitely just kind of watching the news, carefully from my perch in Colorado, and just hoping everything goes smoothly next week.
I'm sort of hoping that, with the fresh start that we'll have next week, that, we're going to make sure that we sort of, don't take our democracy for granted, and also that we'll find a way to get a fresh start and to come together as Americans across not just party lines, but, also across some of the lines like of race and class that have been laid bare by, the pandemic. That brings us into one of the topics that, obviously is a hugely pressing topic in terms of health policy, the pandemic. We've had this sort of split screen reality that, on the one hand, we've got the promise of vaccines. On the other hand, we've got this stark reality day to day. We've got, research showing that, there's ever more serious long-term potential consequences to COVID. We've got the emergence of more contagious strains of the virus. And now, even on the bright side of that equation with the vaccine rollout, we've seen some bumps. Can you talk a little bit about that?
Yeah, I mean, first of all, I in Colorado, we were one of the first states to see one of the more contagious variants. So it is a scary time. We believe the vaccine should be protective against even that new variant, but everything is evolving so quickly. And so I agree. On the one hand, am so excited to see friends and family on social media getting the vaccine, even strangers getting the vaccine. I know some people who've already received their second dose. But on the other hand, it's not going as planned for sure. So some of the issues, as you mentioned, with the rollout are just, people who are eligible, we have these prioritization schedules and groups that are eligible before other groups will be able to get the vaccine. And it's just, we're not reaching all those folks. So it's a combination of issues. States are receiving certain numbers of vaccine, and then there might be log jams in terms of distributing it to clinics and other places. There may be people who don't decide to get vaccinated even though they're eligible, and then people just might be confused. Am I eligible? I don't know. Because states are kind of doing different things, and there's conflicting guidance from CDC on one hand and the administration from another. So I know that, it kind of depends state by state, whether in your age and other conditions, whether you're eligible. My father-in-law was able to get his first vaccine, after my mother-in-law waited on hold for hours to get an appointment. So lots of people wanting to get the vaccine and can't. And then we hear really tragic stories about vaccine going to waste. So the issue is complex, and I'm grateful for all the folks who have been able to get vaccinated, but we really hope to see in the coming weeks maybe a cleaner rollout and more people getting the vaccine who are eligible.
Yeah, I mean, it's kind of depressing. I mean, it feels like, when the pandemic first came onto the scene, and we we responded. I think it's universally acknowledged that we really failed, and we had this horribly decentralized, fragmented, sort of unprepared response in terms of testing and provision of medical equipment and PPE, contact tracing. There was nobody in charge, and everybody was going their own way. And so with the vaccine rollout, we had this, as I said before, we had these vaccines that came on the scene, more quickly than anybody anticipated. We had a second shot, and what did we do? We made the same mistakes all over again.
Yeah, and it seems like there's sort of the federal government and the states are trading blame on sort of whose fault it is. So I'm curious what Biden says about all this.
Yeah, I mean, he's obviously been critical, as I think most listeners probably have seen, of the Trump administration response. He said, and I think what most people consider a pretty ambitious goal, he wanted to get 100 million doses out in the first 100 days of his administration. He had criticized the Trump administration for holding back some of the vaccine stockpile to make sure that, as people know, that you need 2 doses, and they wanted to make sure that the second dose would be available. Now the Trump administration has changed course and has come around to the Biden approach and is going to release all of the stocks. We'll know a little more today, Thursday, about Biden's plans a little bit later, because he's scheduled to give a speech and release some more details about his pandemic response plan. So actually, listeners, when they hear this on Friday, will know more than we do now. So obviously, the pandemic is a huge issue, but that's not, by any means the only health policy issue that's important. Right now, we've got this situation where the old administration is in its waiting days, new administration is coming in. Obviously, the new administration has very different priorities. One of the big issues that is prominent and where there are very different priorities is Medicaid. And of course, in Medicaid, one of the big issues are that several states have adopted work requirements. And I was hoping you could talk a little bit about that.
Yeah, a big push of the Trump administration, in addition to other changes to the Medicaid program, were work requirements, which basically just require people to complete a certain amount of hours of work or job training or the like as a condition of Medicaid eligibility. We recently published a blog by Nicole Huberfeld and Paul Schaefer, talking generally about what the Biden administration might do in its first 100 days, but they talk a lot about work requirements and what might happen with those. So I think they note that 15 states had waivers approved that included work requirements. Not all those went forward. Some were kind of withdrawn, and some got held up in courts. So, a quick move of the administration is to sort of not allow further states to implement further waivers that require work requirements. And then in terms of states that already have them in place, it's a little bit more complicated, and the blog gets into this, so states can voluntarily drop those aspects of the waivers, or there's other steps they can take. But it's certainly going to be a priority to sort of get rid of this step, which I think a lot of folks say is not actually legal, and also doesn't seem to achieve its intended effects. I mean, research has shown that it does increase disenrollment from Medicaid, but it doesn't necessarily increase employment. There are a lot of other areas of disagreement on Medicaid policy, and another big area is block grants, right, Chris?
Yeah, that's right. Actually, early last year, the administration had put out had encouraged states to apply for Medicaid waivers, Section 1115 waivers that included block grants in their Medicaid programs. This has been block granting, which means that the federal government, rather than paying for a portion of each enrollee's medical expenses, as is normal under the Medicaid program, they would give sort of a capped amount to the states, and in return, the states would get a little more flexibility in running their programs. This has been sort of a big goal of conservatives for a long time. The administration, as I say, had put out this invitation There were only two states, I think, Tennessee and Oklahoma, that applied. I think Oklahoma's was withdrawn, but after about a year that this invitation had been in place, Tennessee just the other day, their waiver request was granted by the administration, which is a big deal. It would be the first time that a state had been granted a waiver with a block grant. Now, I want to emphasize that Tennessee's approach is what they call modified block grant, which means that as if enrollment increases more than expected, the federal contribution or the federal payment would go up. But it wouldn't go up if expenses per enrollee increase. There's a lot of worry that might squeeze, in particular, the most vulnerable Medicaid enrollees. Now, the Biden administration has very different priorities. As I mentioned, they are very hostile to block grants. They can certainly pull back on, they can revoke this invitation to states to apply for these kinds of waivers. They'll likely try to actually revoke Tennessee's waiver, as you mentioned, with the work requirement ones. But that could be a little bit harder than it might be otherwise, because just in the past few days, CMS has sent letters to state Medicaid directors inviting them to set up arrangements with the federal government that, in theory at least, would make it harder for the federal government to revoke existing waivers. So we'll see what happens.
And of course, another huge area is Medicaid expansion under the ACA. So we know Biden has proposed to increase incentives for remaining states that have not expanded to kind of get them on board.
Yeah, that's right. And we actually had an issue. Our January issue of Health Affairs just came out, and that has an article in it by Frederick Blavin and Crystal Ramos that actually talks about the positive effect that Medicaid expansion, not surprisingly, has had on hospital finances. So this is going to be an issue not only that advocates and Medicaid enrollees will keep an eye out, but also that hospitals and other providers will take a keen interest in.
Great. And that sounds like a good note to wrap up with. Thanks everyone for listening. See you next week. And if you enjoyed this, tell a friend.